Okay, so welcome everyone. This is our Comprehensive Cancer Center webinar for Cancer Conversations. I'm Jennifer Potter. Thank you for inviting us into your homes and workspaces during this unusual time. Usually we join you from our on-campus studio, and today we're joining you from our homes. So if you have any technical difficulties during the webinar, please don't hesitate to reach out to us, but I think we'll be just fine. Today's topic is caregiver burnout, and our presenter today is Chewning. She's a licensed clinical social worker who has worked as a social worker since 2011. She works here in our outpatient oncology clinic at the UNC Cancer Hospital in Chapel Hill, and she works with patients and their families to provide case management and supportive counseling services to help them navigate their cancer journey. Today, she's specifically here to talk to us about ways we can deal with stress and distress while caring for loved ones and family friends who are dealing with cancer. That seems incredibly appropriate right now given the coronavirus and its implications it's having on all of us, but today we'll specifically be focusing on caregiver stress as it relates to oncology. So without further ado, I'll turn it over to Megan.
Thank you. Hi, thank you, Jennifer. As Jennifer said, I'm Chewning. I am a social worker at the outpatient clinic at the UNC Cancer Hospital. Today's presentation was created before the pandemic, and I do want to take a minute and acknowledge how impactful this pandemic has been on everyone, but especially on those with cancer and their caregivers. So some of the tips I talk about today won't be possible right now, but the majority of them we can adapt and use to be taking care of ourselves, especially during this time. I'm here to talk about caregiver burnout. So a cancer diagnosis affects everyone. It affects the person with cancer and everyone in their life. But of everyone, oftentimes the person most impacted is the caregiver. And so today we're going to talk about some practical tips. And my hope is that if you are just starting your caregiving journey, that you can remember some of these tips to help you from getting burnout, but that if you are already into your caregiving journey and feeling some distress and some burnout, that you can use some of these tips to help you kind of take better care of yourself. So the American Cancer Society defines a caregiver as the person who most often helps the person with cancer and is not paid to do so. So some caregivers are spouses, they're related to the person they're caring for, but some are neighbors or friends. And no matter the way that you became a caregiver, your role is an extremely important one. You are helping care for the person with cancer, and you're trying to help them with physical, emotional, and spiritual needs as they're going along on their cancer journey. And in the cancer world, caregivers can have a lot of different roles. So some caregivers may be doing just a few things each day for the person they're caring for, but some may be doing almost everything. And so some of the things that caregivers do within the home can be to just provide support and companionship. It could be that as a caregiver, you are helping with the meals, buying the groceries. Some caregivers have to help the person they're caring for manage their finances. Another big one is just really running all the errands that everyone needs done in their life and the person that you're caring for may not be able to do. Taking that a bit further, caregivers have a huge role when it comes to the medical care of the person with cancer. So in terms of medication, they might be picking them up, helping the person with cancer take them and know when to take them. A lot of caregivers are one of the primary contacts for the team, the medical team, in making sure that the person is getting what they're needing and following up with what they should be doing. And then, of course, there's transportation. I meet with caregivers all the time because they are bringing the person that they're caring for to their appointments at the cancer hospital, and they're really sitting with them and helping them make sure that they're talking with the medical team about all the issues that they may be having. And most of the time, these caregiving responsibilities are on top of the caregiver's ongoing regular responsibilities. So it's not in place of what you were doing before with your job and your family. This is really an added responsibility. And because of this, caregivers can feel a range of emotions. And all of these emotions are valid and important. Caregiving can make you feel loved and needed. It can make you feel appreciated. Most, but not all caregivers experience these emotions throughout their caregiving, and especially at the beginning of the journey. And as the treatment progresses, it is common to feel other ways as well. Loneliness, loss, anger, there can be guilt, there can be frustration in caregiving. It can be extremely isolating, especially. You may be more physically alone because you are spending more time with the person you're caring for, and you may feel more isolated and lonely in other ways. Maybe at work, you used to take your lunch break with your coworkers, but now you're working through lunch so that you can get off earlier and be available for your caregiving responsibilities. And loss is another common feeling that can be really big. You could be grieving the loss of your previous life and what it was like. You might have had more free time for hobbies and for your family and friends, and you're really feeling the loss of that in a lot of impactful ways. You also may be feeling the loss of someone you love being healthy. The person you care for is now at a different part in their life and they're struggling with some things, and that's a loss that a lot of caregivers grieve as well. So some of these feelings can come and go, and some can hang around a while. Some feelings like this can be really motivating and helpful, but they can also be a sign that you are experiencing some distress in your caregiving and that maybe you need to make sure that you're taking care of yourself as well. I do want to take a minute to acknowledge that the role of caregiver is not always one that is taken on voluntarily. Sometimes this is the case if you're caring for an aging parent and all of your siblings live out of state. You may be the identified caregiver because you're the one that lives the closest. And this can bring on a number of feelings in addition to the ones that we've talked about, especially in relation to those who don't live as close. Maybe you're feeling like they aren't doing as much as they could or aren't helping out in the ways that you feel like they should be able to. So because of all these feelings and how much work caregiving can be, caregivers can experience burnout. And caregiver burnout is defined as a state of physical, emotional, and mental exhaustion. And I'm going to kind of use the word burnout and distress interchangeably. They are describing really the same emotion that caregivers have. So the American Cancer Society does have a caregiver distress list that I've adapted for this presentation to just kind of briefly go over, because I think it does a great job highlighting some of the physical and emotional things that caregivers may be experiencing that really is a result of their distress in their caregiving. The more yes answers you have as I go over these questions, you can just, if you're a caregiver, keep up with your yes answers in your head or on your fingers. The more you have, the more likely it is that you're experiencing distress. But there is not a magic number of yeses that means that you are distressed as a caregiver. And I also want to highlight that during the current pandemic, a lot of us are feeling more stress, especially caregivers. So it is probably going to increase the number of yes answers that you have. So I'm going to go through them briefly now. And if the answer is yes, just kind of make a note of that. During the past week or so, I have had trouble keeping my mind on what I was doing, felt that I could not leave the person I'm caring for alone, had trouble making decisions, felt completely overwhelmed, felt lonely, felt a loss of privacy or personal time, been edgy or irritable, had sleep disturbed because of the person I'm caring for, cried, felt strained between work and family responsibilities, had back pain, and felt sick, which could be headaches, stomach problems, or the common cold. The more yes answers you had, the more likely it is that you are experiencing stress, distress in your caregiving or caregiving burnout. So now that we have an idea of what caregiving burnout is, let's jump into some practical tips for preventing caregiver burnout. Not all of these tips will apply to everyone. Some of them will vary whether or not they can apply just based on your role and how much caregiving you're doing. But my hope is that everyone can come away with 3 or 4 concrete ideas to help them as a caregiver. And even if you feel like all 10 would apply to you, don't start on all 10 at once. Just pick a few to get started with. We're going to talk about the different areas that caregivers need to make sure they're taking care of themselves, and that is physically, emotionally, spiritually, and financially. So let's jump right in with one of the simplest, but one of the hardest, and that is taking care of our basic physical needs. And these are what every human being needs to make sure that their body and their minds are just at 100%. Food, water, exercise, sunlight, and sleep. Often in the cancer hospital, I meet with caregivers and it's lunchtime. They haven't had a meal and they are just drinking coffee to try to get through the day. But it's so important as a caregiver that you're taking care of yourself, because you can't give 100% to help someone else out if you're really running at 50%. While caring for someone, it's so easy. I see caregivers, their schedule is completely around the person they're caring for. And so that really brings us to practical tip number 1, which is to use the downtime at doctor's visits to take care of your needs. There is a lot of downtime with cancer care and cancer treatment. So for example, infusions. It is a wait after your labs to get those started, to get it to go to the pharmacy. And then once you get in the chair, it's a wait before you get started. And most infusions are pretty lengthy. There's TVs in the UNC Cancer Infusion Center with every chair, and that's just because people are going to be there a while waiting for everything to get finished. So as a caregiver, the person you're caring for is surrounded by nurses and providers who can help if something comes up. So you can pretty easily leave your name and number with them, and they can call you, and you can use that time to meet some of your needs. So in the next few slides, I have an example that's a bit over the top, but meant to give you some ideas. And this is for the caregiver, John, who is caring for his sister, Camille. Camille has cancer, and she is seen at the UNC Cancer Center on Friday morning for her infusion. So we're going to jump into his plan of what he could do at UNC to kind of meet some of his needs during her treatment. So to get started, they go up to the infusion center. There's John, walk along. He makes sure that his sister gets settled in the chair. He talks and checks in with the nurse, Sarah. He gives Sarah his number and says, just call me if something comes up. He knows it's a 45-minute infusion, so as soon as it starts, he takes off. And as luck would have it, this is a Friday after the pandemic, so the Patient and Family Resource Center on Friday mornings would have a breakfast, a free breakfast for cancer patients and their caregivers. So he grabs some water and some food, and he checks that off of his list in terms of taking care of his needs. Then he realizes that he hasn't walked or exercised in 7 months. So he takes advantage of the size of UNC hospitals, and he walks back and forth the main corridor that connects all of the buildings, and he checks exercise off of his list. That's a picture of him stopping at the pinball machine at the children's hospital. So he gets a little distracted, but he still gets his steps in. Now, once he finishes there, he goes back to the cancer hospital, and on the basement floor, you can access the labyrinth, which is something that people can use for prayer and for meditation. He walks around there to get some sunlight and to just take a quiet moment. And then he lays down, or he sits on a bench and lays his head back, and he takes a 5-minute nap in the sun, which is the best I could do for sleep in this example. Alternatively, you could go to your car and take a nap during that time and just take a minute to yourself. So when he wakes up, he heads to infusion. Nothing has happened. His sister is asleep thanks to the medication she takes before her infusion. And so he was able to take some time for himself, and he didn't miss anything. And Sarah, the nurse, reports that everything went well. Now, this is clearly an over-the-top example, but it is just meant to make a point that something as simple as 30 minutes on the day of the appointments for the person you're caring for. You can use that and take advantage of what's available at the Cancer Center. Even if it's just you getting fresh air and walking around the parking lot. Take some time to yourself then, especially if that's the only time you feel like you might get. Now, tip number 1 was kind of detailed and over the top. Tip number 2 is really simple, and that is just start small. So if you read the list of what your body needs each day and you were overwhelmed because you're thinking, I don't do any of those, pick one, just one, and start with it. See if you can do it every day for 2 weeks. And research has really shown that if you can go a couple of weeks doing something, it'll become a part of your routine and it won't be such an effort to remind yourself to do it. Some ideas are just drink 3 glasses of water today or take a 10-minute walk. I could eat breakfast before 10 a.m., but for some people, the goal would just be eat breakfast every day. Go to bed by 10 p.m., not lay in your bed for an hour and scroll your news feeds. Just go to bed by 10 p.m. Once these become a part of your routine, then you can kind of start on one more and take care of yourself in small little steps. Tip number 3 is also simple but hard to do, and that is do not skip your own doctor's appointments. And I mean this for every appointment. Your yearly physical, dental checkups, dermatology. If you see a counselor, it's really important for you to do these things. And we're going to talk in a few tips from now about ways to kind of make time for that. But it's just really important that you prioritize your health as well. And don't be afraid, especially if you're the person providing transportation and accompanying the person you're caring for to appointments. Don't be afraid to kind of see if there's a way for their appointments to be around yours. So if you're leaving the Cancer Center and the scheduler says, can you come in next Monday at 10? But that's when your dentist appointment is. Say that, I have an appointment then. Can the oncologist see us at any other time that day? Everyone on the medical team knows that there's a huge value that caregivers are bringing that no one on the medical team can do what they're doing. So definitely speak up if there's something about the treatment that they may be able to alter so that it fits your schedule and you making sure that you're taking care of your needs as well. Now we are going to switch gears from physical to emotional. Being a caregiver, as we've talked about, is really hard emotionally. You're balancing so much. You're balancing what's in your life and what you're kind of managing in someone else's life. And a lot of times caregivers hear people in their lives say, let me know what I can do to help. And the person asking usually means well, but honestly has no idea how they can help out. Practical tip number 4 is to make a real list of tasks that you need help with, and when someone asks, give them something off of that list. Now, when I suggest this to caregivers, they often say, I just don't want to burden people. And my response, my response is always, if that person asking needed your help, would you want them to ask you? So this next slide just gives you some ideas, and some are ones that you kind of hear a lot, and some I wanted to be sort of new ideas. So oftentimes we hear, can you sit with the person I'm caring with? And so maybe you could schedule it during a time when the person you're caring with is usually napping. So the person that would come and help out would really just be there for emergencies. When thinking about help with groceries, we can think outside of the box. So many places have grocery pickup now. There's no extra charge for it. And you can set that up online and even pay online. So when you're asking someone to pick up the groceries, you can already have it paid for and they can just bring it. If you're like me, I always have 10 Amazon returns at any given moment that need to go to the UPS store. You can ask someone to drop off those packages. I mean, you may feel like, well, it's just a quick 30-minute trip to the post office there and back. But that's 30 minutes that you can free up to take care of yourself. You could go on a walk during that time. You could read. You could make sure that you're eating a meal. Also, outside of the box is help with pets and childcare and entertainment. And this is your pets and children and the person you're caring for. I think one thing that people often feel they're neglecting is the people in their life, and sometimes that's a really easy task for other people to do. If the person asking you has children, maybe they can go on a play date, and then you can sort of feel like your kids are getting the attention you want them to get that you may not be able to give right now. As far as distance, I wanted to put some ideas here for people whose family may not live nearby. Now, as is with every type, this will vary by roles and relationships. So these are just some examples. You certainly need the permission of the person you're caring for. For example, let's say I am caring for my elderly mom who has cancer here, and my brother lives in Canada. When I say help with coordinating care, that can mean a number of different things. Let's say my mom needs some dental work, but her dentist is retired. My brother in Canada can look up local dentists where I am and where she is. And not only that, he can make the first call to make sure that that dentist is accepting new patients, to make sure that that dentist accepts her insurance. These are all things that would take a while to do and don't need to be done by the person who just happens to be nearby. As far as grocery order online, I would just text my brother a picture of the food that my mom needs, and then he could set it all up online for a local Walmart pickup. And I would make him pay for it too. That's what I would do with my brother. And forms are the same. So most forms now, insurance forms, if you are needing help with finances, these are all things that can be emailed. He can gather the information and fill it out and just get it back to me for my mom to look over and sign. Same with local resources. Just because I need something that is in North Carolina doesn't mean my brother in Canada can't help me figure out what that is. All right. So I talked a bit about technology when I talk about setting up online grocery orders, but I just want to encourage you to use technology to help you. So it's important, again, just to remember that you need permission of the person that you're caring for to do this. But some of these can also apply to just you and your life. So when you start your caregiving journey, it may have been easy for you to just call your doctor's office when you needed something, to pick up your prescriptions, but now your time is short. And so everywhere you go in, most places are going to say, download our app. The pharmacy, every provider you go to office usually has some sort of app. And I want to encourage you to download those and use those if you can. And if you're not sure how to download and use them, add that to your list. I know that someone asking you maybe can help you figure out that technology. The reason it is so helpful is just because it streamlines kind of the process. So if you're leaving a doctor's appointment and you just can't remember what they said and you can't find your after visit summary, you can log on to your app and it's printed right there. It saves you a call to the nurse or to the doctor's office to see what's going on. And the other piece of this is just information sharing. So I talk with a lot of caregivers who utilize groups like Facebook groups to keep people updated about kind of the cancer journey and as well as things that they need help with. I am not a huge fan of social media because I think the privacy settings can be really difficult, but there are a number of websites, Caring Bridge is one of them, that are set up specifically so that people can update people on their journeys. You would certainly need the permission of the person that you're caring for, but these can be used to give people updates. It could be one spot where you kind of keep a list of things that you need help for. And it's easier in a lot of ways than maybe having multiple conversations to see kind of who can do what. So I would encourage you to sign up and get help with figuring out all the different apps that you can use to help manage your life and the person you're caring for, and to just explore options as far as ways that you can streamline some of the things you may already be doing. And our last tip to help caregivers on the emotional side is to get formal emotional support. And the three kinds I'm going to talk about is just individual, group, and online. Now, individual support, if you haven't done it before, is meeting one-on-one, either in person or virtually, with a licensed counselor or a licensed clinical social worker. And this can be really helpful. If you haven't done it before, it's sort of like caregiving is new and maybe your stress level is a lot higher and you may not even have access to sort of relieve your stress in the ways that you used to. You may not be able to go on long runs anymore. Therapy can kind of help you work through some maybe healthier ways to deal with your stress and can just be a safe place for you to talk about your feelings. So I want to briefly go over ways to access individual therapy because that can be kind of the daunting task if you decide that that would be a good fit for you. One place you can always start is the Cancer Center. So at UNC, we have the Comprehensive Cancer Support Program, and it provides individual therapy for cancer patients and their caregivers. If the Cancer Center that the person you're caring for does not have that, you can still ask to speak to a social worker to see if they have any recommendations or if they can help you figure out where you can be seen. Now, if you're not comfortable asking there or that's not an option, you can also call your PCP and see if they have any recommendations. And that can be a really good place to start as well, because they may have recommendations for someone who is close by you, like a therapy or counseling agency that is near you. It's certainly going to be easier to go if it's nearby where you are. Besides that, there are two other kind of places to look. One is through your job. So UNC Hospitals, my employer now, and my previous employer have what's called employee assistance programs. And you access them, you can usually just read about the number to call either in your booklet that you're given when you start of your benefits, or you can call Human Resources. And usually they provide a set number of therapy sessions with a provider that they contract with in the community, and it's free of charge. Oftentimes that goes for the employee and the members of their family. And this information is kept private from your employer, just like your medical information with your insurance. But it can be a great idea to reach out to them just to see if you already have this benefit. And of course, there's always the internet. So the website that a lot of social workers use to help someone find a therapist in their community is psychologytoday.com. At the very top, it says find a therapist, and then from there, you can filter the results based on location, type of therapist, insurance, or if you don't have insurance, self-pay or sliding scale options. Group support is another option for emotional support. Now, this isn't clinical like individual therapy, it's a support group. A lot of cancer centers, I know UNC where I'm based out of and UNC Lenore, have caregiver support groups that you can go to. Support groups are really helpful in a lot of ways. Sometimes it depends on the group that you're with, so you really have to go and see if it's a good fit. But it can help you feel less isolated. It can reduce stress, improve your coping skills, and a lot of this has to do with it's sharing information and it's sharing experiences, and it can really help you feel less isolated, because a lot of times you may not know or be in contact with someone else who is a caregiver right then. The easiest way to access these would really be to talk to a nurse navigator or a social worker, or to check bulletin boards. So local, like cancer center-based caregiver support groups usually post on bulletin boards, which is pretty old school, but that's the easiest way to find out where they meet, who you can contact if you have questions, maybe how often they meet as well. And finally, online support. There's always an online option, right? These are the most flexible. They are in some ways maybe the least helpful because there's not that sort of immediate interaction that you would have. And there are really, I guess, two big options. Now, I'm not on Facebook, but I have heard many caregivers mention that they are on caregiving support groups on Facebook. I couldn't access them because I'm not on Facebook, but I have had caregivers tell me that they're helpful. And those are really just message-based. Someone's posting a message or a story or a question, and people are responding. And that can certainly reduce your feelings of isolation. More formal online support, cancercare.org has a number of support groups that are online that are for caregivers and their loved ones. And it may be hard to see. Some of them are really specific, like brain tumor caregiver support group, but some are much more general, just caring for a loved one with cancer support group. And if you navigate to their website, or when you're on their website, they have a number you can call. They can help set you up with one that might be helpful. Tip number 7, I've already mentioned many times. If you can't figure it out, ask for the social worker or the nurse navigator. Odds are the question that you have as a caregiver has been asked and answered before. And if it hasn't been, we are really anxious and excited to help you figure it out. So you can ask when you're in person, and you can also call the Cancer Center and ask if there's a social worker or a nurse navigator that you can talk with. We're going to switch to spiritual support. Spirituality is very different for different people. It's not always tied to a specific religion. And I really like this definition just to get you thinking about kind of what I'm referring to. This is by Dr. Christina Polchowski. Spirituality is the aspect of humanity that refers to the way individuals seek and express meaning and purpose, and the way they experience their connectedness to the moment, to self, to others, to nature, and to the significant or the sacred. In terms of spiritual support and taking care of yourself spiritually, my tip is to find new ways to meet your spiritual needs, especially with the current pandemic. It may not be able, even if you had time, to kind of do what you were doing previously to make sure that your spiritual needs are met. One way is really the phone and the computer. So if you express your spirituality through a faith group and you're not able to maybe meet the meetings or the groups that they go to, see if they post online. See if they would let you call in to someone who is there just so that you can participate. It may not be in the same way that you used to, but it can go a long way in terms of just helping you to get through this stressful time. If it's connecting with nature and maybe you just aren't anywhere near the parks you used to go to, or you don't have time for the hikes you used to go on, you can go online and just find different open spaces that you can go to, even if just 10 minutes. If that's the way that your body and mind is used to connecting, even just a small time of doing that can go a long way. There's always an app for that, right? One really popular app right now is called Headspace, and it has different ways that you can meditate, guided meditations, guided mindfulness, and it also has some exercises, and some are for really short time increments and for beginning levels. So that's something that you can do if you just have 5 minutes while you're at the oncology appointment waiting on the oncologist. Kind of put your earphones in, your earbuds in, and let the app kind of guide you through a meditation just to help you with your stress at that time. And always check with the Cancer Center. So UNC Hospitals has multiple chapels and meditation rooms and chaplains that are available, and see what is available at your cancer center. Going back to the other tip, you may be able to take some time for yourself when you're there at the cancer center with the person that you're caring for. Tip number 9 is to start a gratitude practice. So gratitude is acknowledging something outside of yourself that you're grateful for. And a gratitude practice is just a daily activity for 5 to 10 minutes where you write down what you're grateful for and why. And doing this daily can really train your brain to look for the positive, good things that you're grateful for throughout the day. And this can be especially helpful when the days are long and they're full of a lot of stressful kind of responsibility. So these can be really simple. I'm grateful for my car. I'm grateful for the radiation nurse. And it's important to kind of write down and think through why you're feeling grateful for that. Maybe I'm grateful for my car because I don't have to worry about getting where I need to go. Or the radiation nurse because it reminded me that other people are caring for my dad as well. Let's take a quick minute just to kind of practice this. So in your head, think of something that you are grateful for from today. And now think about why. We aren't in a group to share, so I will share mine. I'm grateful for my mom because she took my kids in the backyard and they have not interrupted this presentation yet, I guess I should say. And finally, financial. So finances can be uncomfortable to talk about, but the reality is that cancer affects the finances of the person who has been diagnosed and also the caregiver's finances. This can be direct in ways like as a caregiver, you're missing work, your decreased hours means decreased pay, but it can also be indirect. It could be that your monthly expenses have increased. You're not able to cook as much, so you're eating out more, or especially transportation costs can go up. So tip number 10 is to ask for financial help. Now, some of these tips of where to look for financial help is really just to help you and the person that you're caring for, especially if you're managing their finances or their stress over finances is really impacting your life. Number one place to start is always the Cancer Center. Ask for the nurse navigator or the social worker and see if there are any programs that can help. There are a lot of local foundations that the Cancer Center would know about, too many to list for this presentation, that you would need to ask about. A lot of cancer centers also have gas card reimbursement. Now, sometimes there's income requirements for it. I think the income requirements are usually a lot higher. The income limits are higher than what people think that they would be. And then some of them, the requirement is really just a change in income since the diagnosis, that cancer has negatively impacted your finances. But the gas card, if the cancer patient qualifies for it and you're the one doing the transportation, that can certainly help you out with your transportation costs. Also at the hospital is financial counselors and prescription assistance programs. And so the hospital financial counselors really help with medical bills. Almost every hospital has some form of financial assistance or charity care, and it's important to, if you're struggling with paying bills, to ask about those. And the same with prescription assistance programs. I encounter a lot of patients and their caregivers who don't realize that the UNC outpatient pharmacy has its own financial counselor, and that's because they have a program that can help people paying for their prescriptions. Moving a little further out into the community, every single county has a Department of Social Services. And these administer not just Medicaid and food stamps, there's also programs that can help pay electric bills, they can provide fans in the summer if someone's air conditioner isn't working well, and they also know a lot about local community resources. So giving them a call is always a good idea if you or the person you are caring for is struggling financially. And then I'm just going to kind of pull these up because they're a little bit of the same. So 211 is, you can call them or you can visit the website here, and they're really just a wealth of information on community programs. So this would be for you or the person you're caring for. It may be a little hard to see, but they can help with electric bills, they can help you find community agencies that may be able to help with electric bills. They can help you find mental health resources, healthcare, and basic needs. So you can call them or go to their website, and they really just search by zip code. Cancercare.org has something similar that's on the national scale. And I would encourage everyone to visit that if the person you're caring for is having trouble with their bills. And that would be because cancercare.org, you can search by location, so it will bring up those local grants that may be able to help, but you can also search by diagnoses. So for example, Leukemia Lymphoma Society has a grant of $100 for patients, and Cancer Care would bring that up if you were searching by diagnoses. That brings me to the end of our presentation. I hope that each of you was able to get a few tips or a couple of ideas for how you can take care of yourself. And I appreciate you joining me during this time.
Thank you, Megan. You did a wonderful job. Extremely thorough. I can't imagine how much time you put into that. Thank you so much for all you do every day. If you wouldn't mind just advancing it to the next slide.
Oh, sorry.
You're okay. For those of you who might have some follow-up questions, there's an email address on your screen that you can use, or if you feel real comfortable with Zoom, at the bottom of your screen there should either be a chat bubble or a Q&A bubble, and feel free to use those to submit questions. While you were talking, Megan, one or two questions did come in, and the first one was from someone who is not a caregiver themselves, but is supporting a sister who is a caregiver and was just looking for ideas of how she could be more of a support as her sister cares for a loved one going through cancer.
I think, everything kind of varies by roles and relationship, and I think the first place to start is to ask what she can use help with and ask her to be specific. The phrase, "let me know what I can do to help," is thrown around a lot, so I think it's easy as a caregiver just to sort of brush that off and not recognize that the person may really be wanting to help. And it also could be when I've had some caregivers really appreciate when someone, like you could say your sister, here's some things that I could do. Could I bring a meal by? Could I walk your dog? And just kind of offer her some things. And that way she knows that these are things that you absolutely can do if they're helpful, and give her some options, because it could be, as a caregiver, it can be really overwhelming, and it's just hard to think on the spot of what you could use help with when it feels like you could use help with everything. So I would say offer her some specific things that you can do.
Yeah, that's really great advice. Thank you for that. And then we had one other question come in when you were talking about gratitude journal. This person asked that they've heard about art therapy and journal therapy, but they're not quite sure what that means. And is that with a therapist? Is it something you do on your own? So could you just better explain those two options to this particular viewer?
Yeah, so I think there is guided journaling and there is guided art therapy, but a lot of people are kind of using those terms as just what they're doing to help with their stress relief. So especially in the last couple of years, I know adult coloring books have become really popular, and people use those therapeutically, and that it kind of brings your mind away from what you're doing and you focus on something that is sort of a small task, it's repetitive, and it can be very soothing in that way. And then as far as journaling, I think to get started with that, it's a good idea to just Google it. Getting started with journaling, it looks different for different people. I know people who journal for, an hour every day, but there are a lot of people who only have 5 minutes. So I actually got started with this maybe 6 years ago, like right after my son was born. Someone gave us a 1-line-a-day journal where you just write down 1 line a day of something that happened or something you were grateful for. So that's an easy way to get started as well.
Yeah, I love that idea. That's wonderful. Well, it seems like that's taking care of the questions from your session today. I just want to thank you again for your time and for bearing with us as we creatively do this through Zoom instead of our campus studio. And I want to thank all the attendees who logged in today and made time to learn more about caregiving. Megan, if you could just click to the one more slide.
Oh, yep.
So our next Cancer Conversations is going to be about radiation therapy and just the bare bones understanding what goes into it, how to prepare for it. And this will be appropriate for patients who are just starting the cancer journey, and that'll be on May 22nd. And I can almost guarantee it'll be on Zoom. So please be looking for that invitation shortly. But thank you again, Megan. I really appreciate it. And thank you again to all of our attendees.